I was losing my brain and I want to tell you how I got it back. I'm Dr. Willem Mostert and I'm fortunate to say that I am a dementia survivor. Fred Durst once said that your brain can be your best friend but also your worst enemy. I want to share with you my story of how I found out that whether your brain is your friend or worst enemy depends on how you treat your brain. I was blessed with a sharp brain, but I took it for granted, neglected it, and it sometimes even abused it. Until one day my brain decided to downsize because it lost its zest for my life and turned into my worst enemy. In 2012, at the age of 61, I told my family that I was afraid that I will get dementia one day because I realized that my brain was not as sharp as it used to be. In February 2019, I had a serious motor vehicle accident and was unconscious for a while, but the next day I was back at work. You see the pattern of neglect, abuse, and not caring for my brain? Yes, it was one of my bad habits. In June 2019, I went to consult a neurologist as I recognized that my memory loss and overall cognitive functioning were declining by the day. My MRI report indicated that I have excessive, bilateral, fairly symmetric parietal atrophy, raising the suspicion of young onset Alzheimer's disease. I was told by my doctor that I do not have Alzheimer's disease and that I should return in 6 months. My doctor told me what I did not have, namely Alzheimer's, but not what I had. I had problems with word finding, remembering the names of friends, relatives, and employees, forgetting appointments, struggled to concentrate when reading, had navigation problems, and increased memory loss, such as repeating instructions to employees and forgetting I already did give it to them. After reading up on the progressive stages of dementia, I realized that I was already exhibiting mild cognitive impairment symptoms, the stage of dementia which often precedes Alzheimer's disease. Now let me tell you, there's nothing mild about this stage. I felt so afraid and lonely. Instead of waiting 6 months to see the doctor, I asked God to help me and decided to do research on what can be done to reverse cognitive decline. The first thing I did was consult Dr. Google by asking the question, can Alzheimer's be reversed? The top line of my search was an extract from a book written by Dr. Dale Bredesen named The End of Alzheimer's. He is professor of neurology at the University of California and chief scientist at Apollo Health. Dr. Bredesen has been doing research on Alzheimer's for 30 years and identified 36 biomarkers that can contribute to cognitive decline. At the time of publishing his book in 2018, he already had results of 100 patients he treated, and all of them showed improvement in their cognitive functioning. The results Dr. Bredesen got was astonishing, considering that dementia is seen as a progressive disease that only gets worse. The traditional scientific literature, however, states that there is currently no treatment and cure for Alzheimer's, and that the current medication is less than 1% effective. All the available drugs in use to treat dementia currently focus on removing the amyloid beta plaque from the neuron, which is seen as the cause of cognitive decline. Dr. Bredesen's research indicated that the proteins forming around neurons is not the cause of Alzheimer's, but rather the brain's response to the onslaughts on the brain, and that these onslaughts are the real causes of the decline. In summary, Dr. Bredesen says that what we call Alzheimer's disease is actually a protective response to the different insults on the brain, such as microbes and other inflammagens causing chronic inflammation, or insulin resistance, toxins, loss of support by nutrients, hormones, and brain growth factors, sleep problems, vascular disease, and head trauma. Cognitive decline is thus a protective downsizing program. In other words, Alzheimer's is a brain in retreat, suffering its own collateral damage while pulling back. These insults causing the downsizing retreat can be broken down further into 36 contributors, and at the contributor level, there are in fact many solutions available for many years. As such, cognitive decline can be prevented or reversed by asking why the brain is downsizing and not merely just asking whether the brain is downsizing, which is the question currently used to diagnose dementia. What is the merit of telling someone that she has dementia if you cannot tell why the person has it? I ask myself, is this Dr. Bredesen for real? And is he onto something here that can help me? What made sense to me is that if one cannot pinpoint the real cause for a specific person's cognitive decline, it will remain a progressive disease. But if you can, then at the contributor level, where solutions are available, the current mindset of gloom changes into hope, action, and life. What is more significant is that because these contributors are now known, it means that one can identify people at risk and assist them to prevent cognitive decline. Dr. Bredesen went further and said that people suffering from cognitive decline do not have all 36 biomarkers present. The more severe cases have closer to 25 contributors, and those who are at the beginning stages of cognitive decline has around 10 contributors. The combination of contributors for each person is unique and work together in a compounding manner to accelerate the decline. Wendy Walker says that every brain is different, and so must be every course of therapy. And this is exactly what the Bredesen protocol does in comparison to the current unsuccessful one-pill-fits-all approach. I was deficient in 12 of the 36 biomarkers and decided that I should take Dr. Bredesen seriously if I want to save my brain. For the first time in my life, I asked myself, what can I do to make me healthier? I decided to make the research and protocols described by Dr. Bredesen even more practical for myself and summarized his work into 19 health goals. I also realized that if I want to achieve these goals, I need to develop new habits and identified 19 habits I decided to follow. I followed my plan consisting of 19 health goals and 19 habits, and in February 2020 I went for an FDG PET scan, which showed that I have a normal brain. I already knew that because my symptoms were gone and my brain was back. I now have the confidence in telling you more about my health goals and habits that got my brain back for me, because I realized that to care for my brain should be a no-brainer. Thanks to Dr. Bredesen and his quest to find out what are the real causes of dementia and how to reverse these symptoms. My first goal is to care for my brain every day. Thomas Edison said that the chief function of the body is to carry the brain around. Ichi goes a bit further by saying that in order to be the master of your life, you must first recognize that you are the rightful master of your brain, its owner and operator. We should teach that to our children, because I only learned this the hard way at the age of 68, when it was almost too late. The following are a few things you must first accept if you want to care for your brain. Your brain is involved in everything you do, what you feel, think, act, and who you interact with. When your brain works right, you work right. But when your brain does not work right, you are in trouble. Your brain has needs to be optimal, such as healthy food, healthy blood flow, proper hydration, physical and mental exercise, stimulation through new learning, quality and enough fuel for food, balanced hormones, a good immune system, efficient waste management system to get rid of toxins, adequate sleep, healthy mitochondria to provide energy, and much more. What I realized is that I am not stuck with my brain. I have now, and that I can make it better if I care for my brain. My second goal is to measure my vulnerability for cognitive decline, because that is what I should mitigate. What Tony Sorensen says is so true. Only when people are aware of how vulnerable they are will they start to care. And that was the truth in my case. Dementia is a syndrome with many contributing factors and is not caused by a single factor. So you need to answer the following questions for yourself. Do you have ongoing inflammation, and why? Do you have insulin resistance, and why? Do you have suboptimal levels of nutrients, hormones, and brain growth factors, and why? Do you have specific viruses, bacteria, or parasites that cause your brain to downsize, and again, why? Do you have persistent infections that suppress your immune system? And again, why? Do you have exposure to toxins, and why? Do you have vascular disease? And yes, why? Do you have a brain that was subject to head injury? And what effect does it still have on you, and why? The lab tests which Dr. Bredesen prescribes will give you answers to the first part of each question. And you, your doctor and health coach, must answer the why part, because the real cause of cognitive decline is to be found by answering the why. The next goal is to influence my gene expression. You can inherit good genes, but not greatness. That you must work for by developing productive habits. But you can inherit bad genes and still achieve greatness if you develop productive habits. There are dozens of genes that play a role in your risk for cognitive decline and eventually Alzheimer's. The most common genetic risk, however, is via a single gene called APOE4. 75% of people do not have this gene. Their risk to get Alzheimer's is about 9%. 25% of people have this gene. If they have one copy of the gene, their risk to get Alzheimer's is about 30%. About 2% of people have two copies of the APOE4 gene, and their risk to get Alzheimer's is about 50%. So if a family member suffered from dementia, get tested for APOE4 gene to know your risk. If you test positive for APOE4, you must know that you must make a serious effort to live healthy and decrease all your risk factors. Remember that your genes only load the gun, but your behavior pulls the trigger. The rest of the health goals are all interventions to help you reduce or eliminate your risk factors. It worked and is still working for me. The next one is ensure metabolic health, and it consists of 4 sub-goals, which in combination is very powerful. Metabolic health is defined as having ideal levels of blood sugar, cholesterol, blood pressure, and waist circumferences without using medication. That is a tough task if you do not care for your general health. The term metabolic health is often used to refer specifically to the breakdown of food and its transformation into energy. The Bredesen protocol recommends that the following 4 interventions are implemented together to get maximum benefit. Optimize the effect of fasting, then optimize the effect of nutrition, and then optimize the effect of exercise, and optimize the effect of sleep. This combination heals metabolism and provides clean, sustainable fuel for the brain. It starts with optimizing the impact of fasting. Okay, if we are not supposed to eat at night, then why is there a light in the fridge? Fasting is the greatest remedy. It is the physician within, according to Paracelsus. A little starvation can really do more for the average sick man than can the best medicine or best doctors, says Mark Twain. Have you ever wondered why you do not want to eat when you are sick? It is the doctor within you working the healing magic. The benefits of fasting is a long list. It restores insulin sensitivity, it decreases inflammation, enhances mitochondrial function, boosts longevity, and reduces the risk of heart disease, cancer, and autoimmune conditions. The batteries of your cell are charged during fasting through a process called autophagy. This promotes cell healing and regeneration. Waste is also removed from the body, especially the brain, during fasting. So how should we fast? Start fasting 3 to 4 hours before going to sleep. Fast for at least 12 to 18 hours between the evening meal and first meal of the day. Only drink water, green tea and coffee with coconut milk or MCT oil during the fast, and break the fast with a detoxifying beverage such as water with fresh lemon or ginger or milk thistle or tea from lemongrass, ginger and dandelion. Fasting is difficult for those with insulin resistance, but if you learn to use fat instead of sugar to fuel the brain, you will be able to fast for longer periods. Fasting and the next goal to optimize the impact of nutrients is most probably where I got the most benefit. William Shakespeare said that he would not put a thief in his mouth to steal his brains. Hippocrates, the great doctor, prescribed the following: the safest way to heal is to give every individual the right amount of nourishment and exercise, not too little and not too much. So if you want to be a smart cookie, don't eat cookies. What then should we eat? Definitely not a typical South African diet of high protein, including braaivleis, high simple carbs, sugar, dairy, trans fats, soda drinks, processed foods, toxin-loaded foods full of pesticides, hormones, antibiotics, and yes, not so much alcohol. No, we should eat the following. Pick the healthiest proteins such as free-range, grass-fed animal protein and fatty fish. Eat the right fats, no trans fats, vegetable oils, and stay low on animal fat too. Add omega-3 fatty acids from seeds and use coconut oil, olive oil, and avocados. Eat green and colorful vegetables that grow above the soil. Ensure it is high in fiber and is complex carbohydrates, low in the glycemic index, lower than 35. The combination of these macronutrients should preferably get you into mild ketosis so that your brain can use fat instead of glucose to produce energy and get the maximum benefit from what you eat. Stay away from grains, especially the white ones and their flour, and then say goodbye to sugar forever. Hydrate with clean water because 60% of my body is water and 80% of my brain is water. Flavor foods with smart herbs and spices. Herbs and spices are not just flavor enhancers, as many of them have medicinal value. Oh yes, socialize with family and friends when eating so that you can relax. There is much more than this when it comes to ensure the right nutrition for the brain, but this is already a good start for most people.